In a society that's terrified of mortality, what could be more important than helping people meet death with less fear? Dr. Anthony Bossis is a psychedelic researcher and clinical psychologist who has been working on FDA-approved trials with psychedelics for almost 20 years, focusing on end-of-life care and mystical and religious experiences. Some of his many roles include clinical assistant professor of psychiatry at the NYU School of Medicine, co-founder of the Bellevue Hospital Palliative Care Service, and faculty member of the Center for Psychedelic Therapies and Research at the California Institute of Integral Studies. Today, he will talk to us about psychedelics for psychological and existential distress in palliative and end-of-life care. Please give a warm welcome to Dr. Anthony Bossis.
Hello. It's good to be here. Can't see anything. Thank you to the Eden Foundation for inviting me. It's been a great week so far. I'm looking forward to the rest of the event. It's great to be in Iceland. It's great to be in a flourishing democracy again. Somebody forgot their glasses here. And we're all learning very quickly what we all knew but never really understood, how fragile democracy is. So keep it while you can, folks. I'll turn to a more optimistic subject, and that's death and dying. I've been very lucky to work in this area. For about 20 years ago, we started this work with psilocybin for end-of-life distress, standing upon the shoulders of giants from half a century ago who began this research. And think about them all the time, what they began with this focus. I only have two really primary interests in psychedelics. I'm interested in everything, but in terms of my work, it's the incredible states of awareness these medicines can generate at times in the right conditions for humans, and how those insights, those experiences, what Maslow called a peak experience, Chris talked today about the mystical experience, how they can affect and influence and maybe even change and recalibrate our thinking about our own death and about dying. It's one of the first indications the researchers began back in the 60s, along with alcoholism. Ralph Metzner, who's a great pioneer and also always said it's the most important application of these medicines because we're all dying. And so I want to talk today a bit about the research in palliative care and end-of-life care, and about the mystical experience. And that's not, a conclusive criteria of a definition of what that is, but it's the best we have for now, and it's been correlated with greater outcomes in many conditions, particularly with end-of-life patients. I personally think that the end-of-life application of this, in many ways, has been so powerful, and the results have been so strong, as you'll see. It's because I tend to think at times that psychedelics and the experience they generate is really effective for what I would call normative kind of human suffering that we all go through. Normal existential and just the phases of being human and all its joy, but all of its suffering. And death is one of those very difficult things to deal with. And so the gift of these experiences for those who are dying in anguish and to see the changes we're seeing is remarkable. So I'm happy to speak about the research today in the field. And by way of quick background, I worked in palliative care for many, many years. So there's a paucity of really tools to help people. As we'll talk about today, we have medications to maybe relieve some symptoms of depression or anxiety, but we don't. These medicines get at the underlying experience and could potentially transform that experience and view even death and dying in a different way. And that's a gift. It's better than symptom reduction. It's a change in how we're approaching our death. So that's a relief of the Buddha, allegedly on his deathbed. But that's, what some people would call a good death. We die with integrity and dignity, not in complete panic. And we never know how we're going to die. And speaking of the Buddha, I'll open up with a quote from Roshi Joan Halifax, who runs a wonderful place in Mexico to help with the dying as well, and was actually involved in the early psychedelic research with her husband, Stan Groff, for those who didn't know that. It's a wonderful book I recommend called Being with the Dying. I'm going to read just a few sentences to get us started here today. One who is free of fear knows that at the deepest level of realization, there is no suffering, no birth, no death. Each moment is new and complete. Right now, being born. Right now, dying. All phenomena are in flux. Right in the waves of impermanence, the elements come together as form and dissolve into formlessness. In some sense, we are never born, we will never die. When we realize our true nature, that absolute space free of birth and death, it is possible to dwell in this relative body without fear of loss. We can leave behind fearfulness, denial, sorrow, defiance, and even acceptance to reach true liberation. This is our practice for a realized death. So I'm going to run maybe more quickly through some of the first slides about how we don't die well, and some of the levels of suffering we see in those who are dying. But I could have, I guess, changed Americans and put a lot of different countries there as well. We don't die well. It's also become very taboo to even speak about death, right? We don't talk about it. Ernest Becker spoke about the denial of death. It wasn't always that way, even in America. 1800s in America, people died in the house and the body stayed there actually for a few days. Now it's behind closed doors. We don't speak about it. Same as birth. Birth for, when modernity came in the last century, even that was behind closed doors. But despite it not being so great, I really want to do a shout out that in the last 25 years, there's been incredible growth in palliative and hospice care. Incredible. Every month is a best-selling book on the topic, and it's end-of-life doulas, and it's really progressing. But we can't lose sight of we have a long way to go still. And as an example of that, I put the dates here under these to remind myself how long some of these slides have been here. And there was a time when it wasn't even discussed in medical school. It really was kind of out of the conversation. How many people here are in palliative care or work with the dying or are interested in psychedelics with the dying? Oh, great. Fantastic. Great. A lot of hands. So it really is a very rewarding area to work with psychedelics. So for those who don't know, palliative care affirms dying and as a normal process. It neither hastens nor postpones death. And that's a conversation we could have as well, because that's changing in terms of what we do with the dying in many countries. It integrates the spiritual part of our life, which is crucial. And it encourages meaning and purpose and value, which we do in psychedelics. In 1997, Institute of Medicine made a mandate, change how we die. It was a major event. And change is happening, like I said. However, a recent study showed depression in the final year of life still up 26%. And we know depression, hopelessness are strong predictors for a desire for a hastened death and end-of-life patients. Who here knows demoralization? Any hands for demoralization syndrome? Great. This is a really important category, getting a lot of attention now in palliative care and other areas as well. And if I have time at the end, I'll show some slides on a new trial we're about to start, a multi-center trial in America with psilocybin for people with less than 2 years to live who are demoralized. Demoralization is defined briefly as a strong sense of hopelessness, lack of meaning, loss of meaning, existential distress, and it's not the same as depression. I want to just show you the difference in a little bit, and then move on. So while demoralization syndrome and major depression do overlap in many of its symptoms, there's a common ground there. They're also different. Demoralization is distinct in a few ways, and you could read this data as I'm speaking, but this just confirms the many trials where people who were depressed weren't always demoralized, and many people who were demoralized aren't always depressed. And a number of studies are bearing that out in very, very large numbers. The important thing about this distinction is that while psychopharmacology, SSRIs may help people with depression reduce some symptoms, they're not touching people with demoralization at the end of life. It's not affecting them. And only recently are we seeing this difference. So they're kind of falling through the cracks of even conventional medication. It's because of the organizing principle about this part of it is this lack of meaning, this sense of despair. What they do respond to are meaning-making therapies. And it's my personal belief and professional belief that if anything, and Chris was speaking about this morning, what these experiences can do is generate a sense of meaning in our lives. And the results so far have been very encouraging. I'm going to run through this quick. Take my word for it, you could probably, it intuitively. There's a high level of psychosocial distress and suffering in people with advanced disease, or even a diagnosis made today of cancer, and they may live the rest of their life, but those traumatic events of a diagnosis and of advanced illness are profoundly destabilizing, and depression and demoralization as well. And demoralization is, and I encourage you, if you're in the field, to look into it because it's a remarkable distinction, and a new trial makes that the primary variable. If we can really address that, we've addressed a lot of suffering. Depressed people are 4 times more likely at the end of life to have a desire for a hastened death. But if their depression and hopelessness is treated, there's no desire for that hastened death. We can treat people even at the end of life. This is a meta-analysis done many years ago, not about psychedelics, but I think it speaks to who we are, and to me, it lays the foundation, sets the table for why we do this. They looked at all the themes that come up at the end of life and what people ranked as important and meaningful and where they wanted help. The top 2, there's 3 in red, but 2 of them are the same one, were meaning and transcendence. It seems to me that those are 2 major events of a psychedelic-generated experience that could really transform us. Meaning-making through this transcendent state. The great Viktor Frankl, who was a Holocaust survivor, went on to develop a meaning-making therapy called logotherapy. He said meaning can be found in life literally up to the last moment, up to the last breath, in the face of death. And we know spiritual well-being and meaning have been shown to be buffers against end-of-life depression, hopelessness, and suicidal thinking. And Viktor Frankl gets 2. I love this quote, and it's only a sentence, but it requires a lot of attention sometimes. I'll update it, not man. Humans are not destroyed by suffering. We're destroyed by suffering without meaning. That's really important. So there's a lot there. And Cicely Saunders, who co-founded Hospice, wrote once, you can find degree of wholeness as a person, whether you get better or not, whether you are suffering or not. And I've seen people find wholeness even as they die. And Kubler-Ross, who we all know, if you become whole again, you're healed. And you're healed at the last minute of life. Our disease is independent of who we are. The body is dying. The body is soon going to stop working. But what we're going to talk about today, and people tell us, is that I generated the insight during those experiences on the psilocybin where maybe I'm not just my body. There's something more enduring about who I am. So if I become whole again, I'm healed, not the body. The body's not going to come whole again. The body is failing because of the disease that's ravishing the body. But if we're not our bodies only, we can become healed. This is obvious stuff. I'm going to go through it. People aren't happy with how we die. In our country, the polls are just really, even with all the growth we've had in the last 20 years, people report in survey after survey that we don't die well. And we don't discuss death well. We don't talk about death. We know why. It's not a great topic to talk about. But it is a great topic to talk about. If we can make it part of our lives in a way, not in some ruminative, depressive way, but to be acquainted with it a bit. So it's not something that's going to happen at some point down there or over there or when I get that bad MRI back, but that we develop a relationship with it as we're living. And it seems, even beyond our clinical trials, that the psychedelic generated experience can involve themes of death and dying, even in very healthy people and in young people. It just seems there's something about that experience, not just with psychedelics. I want to be, if there's any takeaways, that it isn't always about the psychedelic. Humans are wired for meaning. We're wired for something else. And those experiences, including peak experiences, can happen in many, many, many ways. Drumming, music, making love, running in the woods, spontaneous, prayer, meditation. We're wired for these peak experiences. And we have them, reasons above my pay grade, but whatever that is taking us into this experience often of these existential issues of death and dying. Why would that be? Why would nature do that or God do that? Pick your language. I'm fine either way. Why? Why are we wired for meaning? Why do we have this capacity to even have these transcendent experiences? And finally, so all the regulatory bodies have really called out for change. And I hope that psychedelics is going to answer that call. I think it is so far. We have a long way to go. So I won't spend too much time on psilocybin. You've heard a lot about it. This is the primary drug we're working with, that I've been working with in these studies. Although clearly other agents and compounds can be helpful with these experiences. Psilocybin, you got the golden lecture today with Paul, so you know what psilocybin mushrooms are. I won't dive into the neurochemistry too much today, but what really matters is the experience. What that's allowing us to explore about death and these people in our trials who are remarkable. And for them to share with us how they've changed. Psilocybin, as you heard today, has been around for a very long time. Mayan culture, Aztec culture, going back millennia. And it came into our life in the 1950s, where Gordon Wasson, who you saw earlier, and his wife, Valentina, who was really an engine behind this conversation. It's always the woman behind the man who's the engine behind the conversation. Met Maria Sabina, and she invited Gordon into a mushroom ceremony he wrote about in this famous Life magazine, and that kind of changed the game. At that point, LSD was already being researched, but we added psilocybin to the toolkit, and Albert Hofmann synthesized it, and psilocybin began to be used in research, and that's what we use now. So I mentioned before my two interests of the mystical experience and then, of course, how it affects death and dying. And the first big study that we all really are standing upon, those of us in the field with these interests, what was the very famous Good Friday study in the early 60s in America, where Walter Pankey gave 10 theology students psilocybin and another 10 placebo. Without going into too much detail, majority, overwhelming majority, 8 or 9, had a powerful mystical experience. And they began to develop this mystical experience questionnaire, the scale we still use today. It's been revised many times with enhanced validity and reliability statistically, but it's the same scale, looking at these cluster of features I'm going to talk about in a moment. And that remains a watershed moment. And in 2006, the Johns Hopkins team replicated that, where they gave healthy people psilocybin. And again, it spiked in a majority this mystical experience. That's the actual room where it took place at the Marsh Chapel in 1962. And we were at a Boston psychedelic conference, actually like right before COVID came, before the wall came down in March. And during a break, a few of us hopped into an Uber and went to the Marsh Chapel and went down the stairs, and we found the room. We asked somebody, where's the room? And that's where that famous study took place. Houston Smith, one of the greatest comparative religion scholars of all time, was a participant in that trial, and one of the greatest proponents of psychedelics. He went on to become really one of the greatest voices in comparative religion, and always considered psychedelics a genuine, serious route to insight that paralleled the spiritual insight. But he was very careful about us being sober about it and using it in a serious way. So what are these features that are so important? These are the main features of the mystical experience questionnaire that we use in our studies. There aren't too many. One is unity, this subjective sense that we're all connected. Everything and everyone is connected. We're all one. And by the way, if we are really connected, if me and you are literally somehow connected, but we don't see it now, are there pro-ethical considerations to take into consideration there, right? How do you kill somebody if they're you? If we're kind of sharing something together, if we're really sharing something powerful, how do we hurt others? The noetic quality, a term coined by William James, as if one is encountering ultimate reality. And it's rare that a participant in our trials doesn't say something like, whatever that wasn't just a drug effect. That was more powerful. That was either ultimate reality or more real than this, or this is part of that reality, all kinds of language. But not, it was a temporary drug effect that has no relevance to my life. Sacredness, awe, humility, holiness, wonder. Deeply felt positive mood, joy, peace, love. We hear a lot about love. I'll talk about that in a few minutes. But I want to underscore that it's not just all peaches and cream, which, the media isn't always so great about capturing. These are difficult experiences. People today have been speaking about moving into the darkness, accepting the pain. These are dark. They can be terrorizing. Well, they're medically safe for the most part, psilocybin. It's not always day at the beach. And so we see a lot of very complex and frightening experiences, particularly for someone who's dying. We also see incredible transformation if they're able to. It's hard. But to move into whatever's arising, moving into the pain, the suffering, the darkness. And that's what preparation is about. Spending time with them, enough time with them, to help them accept that whatever's arising in consciousness, to move into, to encounter, to connect, to ask of it. What can I do? What can I learn from this? And affability beyond language. However, we have people write in the journal their experience, and they write incredible stuff, and I'll read some stuff today if we have time. So, those beyond language, these patients have provided us with beautiful accounts of what happened, as have the greatest songwriters of all time and poets, and all of us can speak the language of whatever that is when we want to. And finally, the sense of transcendence. Transcending time and space, consensus reality, this body. And that's a gift for the person who is dying and whose body's beginning to fail. Again, that insight that maybe there's something more. Because in my experience, the patient would say, it was like pulling the lens back on existence, and I just saw myself on a much larger landscape. And that kind of changed, how I feel about suffering and who I am. This is a great group of thinkers who wrote an article on what is healing, and their conclusion was that it's a transcendence of suffering. Albert Einstein, who I think was a modern mystic, no doubt, he didn't need psychedelics. Sometimes you get lucky and you're born with that kind of brain. Not most of us. The most beautiful, profound emotion we can experience is the sensation of the mystical. It's the fundamental emotion that stands at the cradle of true art and true science. And before we go on to the contemporary research, some of the old-timers, the founders of all this, there was some lovely papers and research in the 60s at Spring Grove, and I'll talk about that in a second. Albert Hofmann with the trench coat, who discovered LSD, and was an incredible life he had. In the middle is Walter Pahnke, who did the early trials with cancer and also the trial with theology students. As a follow-up, we're about to publish this year a study that I'm really proud of, where we gave psilocybin to religious leaders of all faiths, and we're gonna present the results as well. So this gentleman did all that, and he died tragically very young. He went scuba diving and never came back, never found his gear. Very tragic. And the woman is Helen Bonney. So she may look like a very square woman. She's not. So this is the woman who devised the playlist, the music for the trips, for the experiences. And we still use many of those songs today. And it was, this trajectory of music. In those days, it was on albums. So imagine, you're doing a session, you keep changing the records. It's like when you were a kid, you had records everywhere in the room, and you had to kind of get the... But that was a dream team. And because of them, we're here. And Walter said, I have to move quick here, 18 minutes. If the use of psychedelic psychotherapy for the dying patient ever should become widespread in our society, we're trying, Wally, we're trying. There would probably be a change in our whole approach toward death. There might be less fear and more acceptance of this part of the life process. This part of the life process. It's not there's life, then there's death. It's part of the same process. And he made that quote 60 years ago. So real quick, in the 60s to mid-70s, but it was petering out by the early 70s, there were these wonderful trials with LSD, mainly LSD, and people with advanced cancer. And those are the papers and the research we stand upon. And because of them, we're doing the work we do now. The first trials that come out of the last, this new period, were our team at NYU, a team at UCLA, and a team at Hopkins. And now we're seeing more research happening globally with psychedelics and end of life or advanced disease or even a traumatic diagnosis. And we're about to start this new trial I mentioned before with looking at demoralization as the primary variable, first time being done, in people with less than 2 years to live with a considerable level of demoralization. And an interesting point here, the mystical experience or the peak experience or numinous, it doesn't matter what you call it, these words are all kind of so meaningless when you really try to talk about something. But they've been shown to be very similar to the ones that occur naturally. So this great Hopkins survey looked at the psychedelic one and the natural ones, and they're the same. You see in the bottom part of the screen, much more than half rated these to be all these things, benevolent and sacred. We know through near-death experiences, people come back from those experiences, and have an experience just like this or similar to this experience, with the same values being generated and their lives being reordered. And why would that be? There remains the question. I can't give you an answer. Why would we be wired to have that kind of insight? Because the answer to that question is an important answer. And the godfather of it all, in my eyes, the great Aldous Huxley, who took mescaline from Humphrey Osmond and had his first experience in the 50s and wrote that famous book. I love this picture. This is an actual picture of Aldous Huxley on his first mescaline experience in California. I love it because of its historic nature, but also only an elegant, classy, British author would come to his first, mescaline experience in a tweed jacket, cuffed pants, no cheesy tie-dye for Aldous. I want to underscore that the research we do to help people who are dying is intentionally at a very high level of the drug to generate that mystical experience. There's also psycholytic therapy, which was a therapy popular back in the 60s and 50s and 70s, lower dose in concert with psychotherapy to facilitate psychotherapeutic benefit. There's the microdosing level, which you all know what that is. But we want to generate this peak experience. That's where we think that window is for change. Let me talk about our NYU study. We published this in 2016 along with the Hopkins team. We had two separate studies, completely separate, no crosstalk, separate. Both involved psilocybin, both involved people with advanced disease, advanced cancer. And we published it together, both papers in one issue. And that was a really important moment going forward. I'm going to read to you a few lines from some of the people in our trial, and I have more vignettes to read later if we have time. Some of these people have since passed away. Many of them have, actually. One person said, "This changed my life." Another, "I can't even," you don't see that. "I can't even imagine it," referring to her fear of cancer. "I felt a constant state of becoming. I felt gratitude like never before. I felt welcome. Death doesn't matter." From a person about a year away from death, "I'm less afraid of death. Death is part of life." Now, one person was in remission, but was paralyzed with fear of a recurrence, and that's her quote. Well, she wrote a whole thing, but that's one of her lines. Weirdly enough, she got cancer again later, a couple years later, a different cancer, and survived that one as well. And we get very close with these patients after the trials are over, and she told me even after the second bout of cancer, it was the memories of this experience, the first one, that helped her through that one. The feeling that one is eternal. Everything happens in the moment. That's that transcendent experience. Past, present, and future collapse into this moment. And the physicist, Albert Einstein, told us there was only this moment. Time is not sequential. And everything is love. We hear about that a lot. We're looking at a lot of variables, still publishing papers from this data set. The main ones were depression and anxiety. I'm going to run through this quick so I don't want to run out of time. So you all know there's a preparation period for all these trials. And of course, that goes for these trials as well. It's so important to not rush those phases. There's maybe a trend now for quicker prep and quicker integration. I'm not sure why, but I know why, but we don't have to do that all the time. So we spend a fair amount of time with people, best as we can, helping them prepare for the experience. We can't predict what will happen, but we can help them kind of cultivate a stance, how to go into the experience. And the main one, again, is that to accept whatever's coming up and to move into it, to trust the experience, trust consciousness, trust your consciousness, trust consciousness. Let go, be open to everything that's unfolding in the room. Then the medication session, then, of course, follow-up integrations. That was the room for the first trial. It was a great room. So that's in a hospital, but it looks like a nice living room-like setting. That's the day of the session. It was actually the second session I had guided, so the patient hadn't come in yet. And so the rooms are decorated in a soft way. Nice art, some books, a very nice rug, expensive rug. You got to get an expensive rug for these trials. So if you're thinking of doing a protocol, the team made a grave mistake in allowing me to go get the rug, and we were in Manhattan. And I have the credit card, and I'm roaming. We're like in the carpet district, close to it. I came back with a great rug, but way over the budget. But that rug is why we have a lot of good experiences, I think. Let me talk about the results a bit. So the study was, the protocol was that every patient would have both psilocybin and the placebo, which was niacin. It was set up where half the cohort had psilocybin first, half had psilocybin, and at 7 weeks, they had what we call a crossover, and the folks who had psilocybin then got placebo, and those who began with placebo then got psilocybin. So we wanted a measure, of course, before the crossover to compare the two. We also then have ongoing ratings for 8 months and 4.5 years I'm going to show you. But the real powerful ones are that really comparing the two. And so you see here, dose of administration. Blue is the placebo group. And immediately, the psilocybin group, big drop in this anxiety and depression score with, for those researchers in the room, effect size is way over 1, which is very, not too common in psychotherapy research or any research really. And then at this point here, if I showed you the rest of this line would come down, which it does, because then they get the psilocybin. So everyone at the end of the trial had similar results. Another anxiety scale, again, big effect sizes, day of administration, psilocybin group with significant change. Depression, this is the HADS-D depression scale. This is the Beck Depression Inventory. Again, day of administration, people on psilocybin drop to these low levels. The effect sizes, placebo group stays up here. A little bit of a dip too, and probably because of just the transference to the guides and being in a trial. It's a comforting trial, supportive people. So everyone got a bit of a bounce initially as well, but nothing like this. This is important. So we spoke, it's hard to treat hopelessness and demoralization. It's really hard. There's a paucity way to treat it. There's no FDA-approved medication combined with psychotherapy that can treat demoralization. But look what happened here. The psilocybin group immediately dropped the demoralization scores compared to placebo, and the same with hopelessness. This is like the golden nugget of the trials, because these two things are really what is driving profound suffering and suicidal thinking and behaviors in end-of-life patients. I'm going to just jump through that. More than half people rated it the most spiritually important experience of their lifetime. Almost 90% reported a general quality of life. In a paper, you'll see much more data, but there was a lot of variables that we looked at. I said they're safe medically, and for the most part, psilocybin is a pretty relatively safe compound compared to other medications we've been hearing about today, actually. But nothing's scot-free of risk. And so we do see elevation. This is the 6-hour stretch of the session with blood pressures and heart rate. So we do screen out for people with unmanaged hypertension, certain arrhythmias. So we have a fair amount of medical rule-outs as well, despite it being relatively safe. But our new trial is trying to work more and more in the direction of how much can we do? What's pragmatic, which is the name of the new trial. It's a pragmatic trial, trying to look at it in the real-life setting, not just in laboratories, but in real-life palliative care centers. What's reasonable to expect in terms of risk. But this will always be a risk. The Hopkins team, I won't go through the research, the data, but same results, but a more crazy scale chart. So 4.5 years later, we contacted the survivors of the trial. At this point, over 2/3 had died. And at the 4.5 marker here, we re-administered the scales to them. And we see all the anxiety depression scales were sustained at the 4.5-year marker, as did these two really important indicators. Now, in fairness, we're not comparing them to something else. So, and a lot of life happened in those 4 years. But this is published in the Journal of Psychopharmacology, and it's significant. And above 70%, up to 90%, the most meaningful, spiritually important, positive, well, all these scales, which are striking. So we saw these reductions in depression, anxiety, demoralization, enhanced spiritual well-being. And here's that kicker again with that mystical experience stuff. The greater outcomes were correlated with that mystical peak experience. Now, it doesn't mean there aren't other experiences. I don't want people to walk away with, well, you have to have that experience. That's not true at all. And we could spend a few hours today discussing all kinds of experiences that can happen on a psychedelic outside of some peak kind of transcendent experience. But in terms of this study, that cluster of criteria that I showed before was more correlated with these greater outcomes. This is a patient who I work with. For those who read the Michael Pollan book, Patrick had already died. He died a year after the study. But Michael has spoken to his wife and profiled his life and experience. I'm going to run out of time. I could read something later. I could meet you in the hallway and read you a little bit of his narrative. He wrote a beautiful narrative about his experience. I'll just sum it up without reading the words right now for time. But he had a great life. He had a great marriage, a great life, busy. He was a journalist. But he said what he came away with is that love. It was all about love. Loving kindness towards self, towards others. And that was really the healing nature of what he kept speaking about. And he died young, in his 50s. And for some of us here, you know that's young. The great Thich Nhat Hanh, who also died a few years ago, also over 100, same as Albert Hoffman. These guys live a long life who do good work. Our true nature is the nature of no birth and no death. Only when touching our true nature can we transcend the fear of non-being, the fear of annihilation. Is that what this Zen teacher is telling us? Is that what our patients are experiencing? You know, this place of suffering, because everyone in our trials speaks about moving into the suffering that comes up. We can't deny it. And by doing so, there's insight. There's a great quote by Rumi, "The wound is the place where the light enters you." And for my Canadian friends in the audience, I'm going to quote a great Canadian, Leonard Cohen. "Ring the bells that still can ring. Forget your perfect offering. There's a crack in everything. That's how the light gets in." It's through the suffering of this disease they were given, this cancer, that they can often find incredible insight. And what really matters? What really matters? Near-death experience trials or experiences are fascinating. And we're doing some work with those experiences as well. Kenneth Ring was one of the great researchers, Raymond Moody, another one. And they both speak about love being the most important thing. They hear from those patients as well, those people as well. People who had a heart stopped, flatlined, or resuscitated, and report their experience, just like the ones in our trials. A lot of overlap, and that love was everything. And Huxley once said that in a letter to Humphrey Osmond. I'm going to recommend the book, Psychedelic Prophets. It's a great book, came out a couple of years ago. It's about this big. And it's the letters of Huxley and Osmond. It's all their personal letters, and it's a touching book. What came through the closed door was the realization, not the knowledge, for this wasn't verbal or abstract, but the direct total awareness from the inside of love as the primary and fundamental cosmic fact. Now, for those who might accuse me of having too many spiritual quotes, doesn't matter, it's spirituality, it's secular, it's all the same thing. I'm going to talk about another bunch of people who have these experiences. Astronauts do. So the overview effect is an effect that astronauts have had when they're on the moon, on the space shuttle, and they see, as Carl Sagan called it, the pale blue dot floating in the sea of blackness. And they've had full mystical experiences. A famous one was Edgar Mitchell on Apollo 14, coming back from the moon. And you can read his words here. He was looking out the window and he saw the moon, the stars, the sun, and he went to a full-blown peak experience. Came back, left Apollo. He founded a great organization that still does research today on consciousness. So we're wired for meaning. And psychedelics are pretty reliable in generating those experiences when done properly in right supportive settings. Our new trial, quickly, can I go a minute over? Where's the person in charge? Can I get a 60 seconds? Good. A new trial, we're going to begin in about a month. A couple novel parts to it. We're going to use a little ketamine as the control, trying to help mask it. We're going to have an apprenticeship component. We're going to take place in palliative care settings around the country. So when we leave in 2 years, pack up and get out of there, people on those teams have been trained in doing this work with people who have advanced disease. We have a therapy manual. Let me get to the end, and I'm going to close, with a quote by Albert Hoffman. And he was a really great human being. Alienation from nature and the loss of the experience of being part of the living creation is the greatest tragedy of a materialistic era. Therefore, I attribute absolute highest importance to consciousness change. I regard psychedelics as catalyzers for this. They are tools which are guiding our perception toward the deeper areas of our human existence, so we again become aware of our spiritual essence. Psychedelic experience in a safe setting can help our consciousness open up to the sensation of connection and being one with nature. It is my great concern to separate psychedelics from the ongoing debates about drugs and to highlight the tremendous potential inherent in these drugs for self-awareness, for therapy, and for research into the human mind. I thank you, and good seeing you all here today.